Good evening. My name is Jeff Thielman, and I'm the president and CEO of the International Institute of New England. It's a pleasure to welcome you to our virtual town hall. At our last town hall in April, we shared updates on our Resettle Together program, which pairs vetted volunteers with IINE staff to welcome and resettle clients. The program has been expanding rapidly to match a growing number of refugees and the need for community support and integration. Tonight, we will be discussing another community support integration topic, the demand for increased services for our Haitian clients. Over the past few months, our region and IINE have welcomed an unprecedented number of Haitian immigrants. To give you a sense of how great the need is, last year, our organization provided services to 4,000 refugee and immigrant clients. Around 12% were Haitian. This year, we are on track to serve 10,000 people, and we estimate that up to 50% of them will be from Haiti. But first, as we begin every town hall, I would like to remind you of IINE's mission and the theory of change that guides our work. The mission of the International Institute of New England is to create opportunities for refugees and immigrants to succeed through resettlement, education, career advancement, and pathways to citizenship. We have offices in Boston and Lowell, Massachusetts, and Manchester, New Hampshire. And we have built strong partnerships in these communities with school districts, healthcare centers, and other organizations that serve the community. IINE offers a continuum of services that helps refugees and other immigrants resettle, stabilize, and integrate into the community. Clients enter our services at various points in the continuum and may leave and re-enter as their situations change. Now onto the topic of the evening. You will hear about why so many Haitians are making the difficult decision to leave their home country, the challenges they face once they arrive in the United States, how IINE is playing a leading role in responding to this crisis, and what you can do to help. Chief Advancement Officer and Senior Vice President Zan Weber will walk you through how Haitian immigration to the United States has changed over the years, the programs and partnerships we're putting in place to support this vulnerable population. Then two IINE staff members, Rodeney, Pierre, and Schaid, Thelot, will be in conversation with each other. Rodeney and Schaid are both Haitian immigrants and will share their own perspectives on the situation. At the end of the program, there will be a Q&A where Chief Program Officer Anka Moraro and Managing Director of our Lowell office, Caroline Rowe, will answer questions you may have. I'll now turn it over to Zan Weber, our Chief Advancement Officer and Senior Vice President.
Thank you, Jeff, and everyone. I'm so glad to be here tonight and share information about the wonderful Haitian community that is coming into Massachusetts and New England, and the unprecedented level of need that we're seeing. But before I dive into how IINE is supporting thousands of Haitian immigrant families, I wanted to spend a few minutes discussing today's situation in Haiti and the complicated push factors involved in so many people fleeing that country. Haiti was the first free Black republic in the world and declared its independence in 1804. Since then, the country has had a long and troubled history of foreign intervention that spans centuries. But we're going to be focusing on the most recent years. Between 1995 and 2015, the Haitian immigrant population in the US tripled. In 2010, an earthquake struck Haiti that displaced 1.5 million people. The US responded by offering affected families temporary protective status, and many people left Haiti for US communities. A few years later, under the Trump administration, in 2017, TPS status was revoked for Haitians, and Haitian immigration was further discouraged in 2018 when the administration blocked agricultural and seasonal work visas for Haitians. Then in 2021, two devastating natural disasters struck, an earthquake and a tropical storm. And in July of that year, Haitian President Jovenel Moïse was assassinated, leading to political void, a surge in violence, and economic freefall in the country. These events have combined to make Haiti today one of the most economically disadvantaged nations in the world. Violent gangs have become so dangerous and poverty so rampant that many Haitians are struggling to survive. It's estimated that at least 500,000 people have fled Haiti in the past few years alone. Fortunately, there are pathways that exist for Haitians to legally enter the US. Haitians have three different options. Temporary protective status, which allows foreign-born residents to stay in the US until it's considered safe to return to their home country. This status does not include eligibility for public benefits or housing support, but it does include and allow for work authorization. The second area of support and entry is Cuban Haitian entrance status, which allows Haitians to stay in the US for up to 2 years. This status creates eligibility for benefits, a green card, and work authorization, but does not cover housing. The third option is a new program called the Cuban Haitian Nicaraguan Venezuelan Parolee Program, which allows humanitarian status for Haitians to enter and stay lawfully in the US for 2 years if they have a sponsor in the US who commits to providing financial support during this period. This status does not create a pathway to residency for Haitians, but it does allow for work authorization. Unfortunately, however, the process of receiving employment authorization can take up to a year. New England is home to the third largest Haitian diaspora in the world. Many Haitian families arriving now have sponsors, families and friends from Haiti that are coming to join. Others are coming to be a part of the broader Haitian community in the country, to join the US workforce and to contribute. But there are significant challenges. A reality for all low-income immigrants and most of the people that we serve is that building a life here is not easy. Many Haitian immigrants are arriving at a time of record housing scarcity and expense, and without a way to support housing on their arrival. Many are therefore transient, staying with their children on couches and families and friends, and more are attempting to enter the overcrowded shelter system in Massachusetts, which is experiencing its own crisis. Some have sought shelter in hospital emergency rooms. You may have seen that reported on the news, and other places that are not shelters and are buckling under the weight of their need. Worse, some families are sleeping on the street. Because authorization to work can take months and months to receive, many families have no income for a long period of time. Haitians need our help in hanging on in our communities. IINE is supporting thousands of Haitian families this year. As Jeff shared at the start of the evening, last year we served about 4,000 clients, 12% of which were Haitian. This year, over 50% of the 10,000 people we'll serve will be Haitian. This is in part by choice. As an organization, we've made a commitment to serving Haitian arrivals and are now serving more Haitians than any other resettlement provider in Massachusetts. Our staff, which includes many Haitian case specialists, work with clients on many different levels. We assess needs, we enroll in ESOL classes, we enroll in children in public schools. We apply for documentation needed to get a job. We enroll Haitian Creole clients in Haitian Creole driver's license classes. And most importantly, we are a gateway to federal benefits and cash assistance. We help individuals apply for welfare food assistance, and healthcare, unlocking federal dollars to support families in need. One of our greatest challenges is that we are not a shelter provider. We are working closely with the Massachusetts Office for Refugees and Immigrants and the state's emergency shelter providers to support families connecting to the emergency shelter program. Our Chief Program Officer was spending the entire day today working to resettle 50 families who were brought from one hotel on their way to another to our offices just to get some support, some food, some water, and to rest. We're also working at the state and the federal level to advocate for more equitable resources for all immigrant populations. We repeatedly see racist immigration policies that provide Haitians and other populations with fewer benefits than other groups. Finally, we're not doing this work alone. One way IINE has been able to reach so many Haitians in need of our services is through our strong partnership with the Immigrant Family Services Institute. IFC is located in Boston's Mattapan neighborhood, and it's a destination provider for arriving Haitians. Our partnership has included service clinics to help thousands of clients apply for public benefits and services, as well as joint advocacy efforts to secure enough resources to meet demand. Effectively addressing the immense level of need of the arriving Haitian community requires coordination and partnership among the government and community organizations. We are so grateful for IFC's partnership. At this point, I'd like to invite my colleagues, Rodeney, Pierre, and Schaid Thelot to join me. They're going to introduce themselves and share about their work.
Hello, everyone. Thank you, Zen, for the introduction. My name is Schaid Thelot. I'm from Port-au-Prince, Haiti. I came to US when I was about 15 or 16. So that gives roughly 8 to 9 years ago. I came to US because my mom felt like I would have more opportunities, and also that would give her more of a financial security for herself and the family. Truthfully, for as far as I can remember, life in Haiti was pretty much always hard, and the unknown pretty much constant. Now I work at IINE as an executive administrator.
Hello, everyone. My name is Rodeney Pierre. I'm a case specialist at International Institute of New England. I'm from Wanamit, a border town located within the northeast side of Haiti. I arrived in the US in November of 2014. I joined my wife here, whom family was living here very long time before her. So it was only normal for me to come to Boston. With that said, I have always heard about Massachusetts is a city of opportunity, from personal to professional. And thank you to give me the chance to be there today to talk about Haiti. Schaid, I know that both of us still have family in Haiti, family members and friends in Haiti. And I know you came from like the city of Port-au-Prince, which is the most focused in Haiti. This is the capital where a lot of things happening right now. What is life is like for them right now in Haiti and specifically in Port-au-Prince?
Well, if we're being honest, life is very dangerous right now. It was always dangerous, but it got worse when the president was assassinated and was in his own house. So it felt like from that point, nobody was safe. So there is a political instability, gang violence, kidnapping happening at all times. People are living on one day at a time, literally just one day at a time. They work all day long and they use that money to buy their family only meal of the day. What can I say is there's not a lot of hope. They're just trying to survive as it is.
Right. I think that is something not a lot of people understand. Over the past couple of years, Haiti has changed. Before 2021, there were people trying to leave, but not like today. He has become so dangerous, and because of Zen described, the Biden administration has expanded our option of Haitians. Many more people are leaving and coming to the US, especially in New England. I want to ask you about your experience sitting at the front desk of International Institute of New England, IINE. You are the first face many of our clients see, and I know you provide them with hope. What is like greeting dozens of Haitians every day?
Like you said, I see many Haitian arrive every single day, and often they're with family. They have little kids. Some of them are pregnant, and they will travel from afar to just come here for an appointment. Like you said, all I want is to give them hope. They come to IINE because they hear that we can help them. And most of the time, I can see how relieved they are when I greet them in Haitian Creole. They know that they have found a place that will support them. A few of them actually told me that previously when they come, there was nobody who was speaking Haitian Creole, so that that's definitely something that they're grateful for. It is my job actually to schedule them with case specialists like you, Rodeney. But again, over the past few months, you have helped hundreds of Haitian immigrants access the benefits and services that Zen previously described. So I would like to know, what are you hearing from these Haitian clients on a daily basis?
That's a good question. From my experience as a case specialist at IINE, according from what I hear from them, life here in America, especially in New England, is safer for them, but there are still so many unknown. Most of our clients do not have a place to call their own. They have been living with family and friends or in shelters. Though many can't even find a place in a shelter at this present moment, they do not have any privacy or place to cook their own food. And I know, I know my people, Asian are hard workers. They want to find job. And I know that as soon as they do, they will want to get like their own place to stay. But receiving an employer authorization card to work can take very long time. These are some of the biggest challenges Asians are facing here. Finding housing and being able to work. There isn't a good solution or system in place right now in this community need. Schaid, on top of that, there's education aspect. You and I about important is to these clients and learn English. But the wait list for our ESOL class is very long. Not being able to communicate and can create a lot of loneliness. I know you hear different story every day. What helps you keep going, Schaid, for the job that we're doing?
As an immigrant, I know how it is to come from another country to another. Like I said before, I came to United States when I was about 15 or 16. I know how it is to be on both sides of the line. Life is pretty much not unimaginable in Haiti, and it takes courage actually to leave what you've known all your life and to come here to the unknown. When I chose IINE, I wanted to be part of a change. I'm sorry. I wanted to help people and make a difference. Our clients today know that they can count on us, and I know that you get messages and calls all day long. Clients are reaching out with questions and needed advice. I know that within IINE, we do our best to get them the help that they need, and knowing that clients trust us and they're grateful to IINE, that's what keeps me going, to be honest. Like I said, there are a lot of unknowns, but we provide them with the help that they need with what we can. Our client appreciate us for this, I believe. So that's what keeps them going.
Thank you, Schaid. I'm going to invite Zen to join us again. Thank you.
Thank you, Rodeney.
Thank you both so much. Your work has just been extraordinary. We could have never reached out and tried to commit to serving as many Haitians as possible without your extraordinary efforts, and your ability to bring in and leverage the entire community to support us. I'm going to talk now a little bit about how everybody on this call can help. We've had unprecedented turnout for this call, which really, I think, as Rodeney and Schaid were saying, helps keep us all going, knowing that we're not alone in meeting this just incredible demand that the Institute has not seen before, this many people in so much need. So we also wanted to offer ways that you can help us. We couldn't serve the record number of people that we are serving this year without you. Our program is not funded fully by the federal or state or any government. We're really a three-legged stool. The federal government puts in some funds, the state government, and we seek community support for all the people who are coming into our communities, hoping to start their lives here. And by doing that, they're really becoming a part of our future. One of the ways that you can support us are donating funds. We actually put up a QR code here. So if you're moved right now, you can, take your phone and connect to that and know that your donation is keeping all of our doors open. About 30% of all of our funding comes from private and community support. And we spend a lot of time all year long trying to get communities to understand some of that responsibility and to work with us and partner with us. Our federal funding is very restricted and it doesn't cover the costs of a lot of our needs. And for some of our programs, it covers the cost of some individuals in the program and not others. So we're hoping for support to help everyone. Another way you can support us is to donate goods. We're collecting items at all of our sites. You can visit our website, and we put in a link here for a list. I was just in our Boston office goods room today, and I noticed there aren't enough children's toys or crayons or paper or things that we can give people when they come in and they're just desperate and they have no food and no clothing and no resources. So we greatly appreciate goods, also in the form of gift cards that we can give someone and help empower them to go and get some of the items that they'd like to pick out for themselves. Another way to support us is volunteering. We have an incredible volunteer program. We have so many people that are helping us, and also a lot of opportunities, including transporting clients to appointments, helping tutor adults in English, delivering food to our clients, and many, many more opportunities. So you can go to this link on our website if you'd like to get personally involved with your time. And then the final way to support us is sponsoring a family. Our last town hall went through all of the ways that we're building a community sponsorship program to allow individuals and groups to be trained as partners to support us and our staff in welcoming and supporting and integrating families of immigrants. And that is information that's also available on our website. So tonight, we would love for anyone who has questions to use the Q&A function of the webinar. We've left a lot of time for questions because there's so much interest in our webinar tonight. And we have Anka Mararo, our Chief Program Officer, and Caroline Rowe, our Managing Director of our Lowell site here with us to field some of the questions and some of the answers. And I think that they're going to start by opening it up, and we've got some questions I think already out there.
Hello everyone and welcome to the webinar. I hope we can answer all your questions and you learn a lot tonight. So one of the questions that came in is about welcome centers, and people read a lot about welcome centers in the news lately. Is IINE a welcome center? How does IINE work with those centers? Caroline, can you answer to that question?
Yeah, thank you, Anka. Hello, everyone. I'm Caroline Rowe. I'm the Lowell Managing Director at IINE, and we're not a welcome center, and we're currently not working with welcome centers, but we are working on a plan of how to support. We currently, in our Lowell office, are working with a hotel that is serving as a shelter for Haitian entrants. We are working to enroll them in all of our services, providing public benefits, refugee cash assistance, and making sure they have access to health services, specifically the refugee health assessment. So more news to come soon on how we will be working with welcome centers.
And to piggyback on that question, how do people get access to the benefits? Like, can you get a little bit in more details about that?
Yeah, so for someone to access benefits, they first contact our office and we schedule a time to meet with them. We meet with them, we get all of their eligibility criteria, their documentation, we confirm that they are eligible, and then we work on enrolling in those public benefits. So we are working and enrolling in refugee cash assistance through our office. We have a system to enroll them, and then we make sure that they get that check every month. And then we also work to apply for mass health, and then through the DTA for TFDC and food stamps.
Thank you, Caroline. How about housing? How does IINE support housing for so many people?
Yeah, so housing is a challenge. We do support with housing for refugee clients through our reception and placement program. And then we really support with our clients in accessing those public benefits, which are crucial to help keep clients housed. And we also support with getting clients access to shelter services. We are not a shelter, but we make sure they have access to shelters and housing.
How about the demographic of the Haitian populations that we are currently seeing, like age and gender?
Yeah, I'd say from what I see in our office, which we did do around 300 Haitian intakes last week, a lot are very young, I'd say 20 to 25 years old. Majority, it's a mix, male and female, but majority are single clients, 20 to 25. We have I'd say like 10 to 20% are families. Some are single moms with children, and then some small families of 3 or 4.
And also to mention that the families who came to our Boston office today, we had 10 families in, around 50 people. And I think most of the children in those families were anywhere from babies to 7 years old.
Mm-hmm. And
so,
I'm sorry, Anka. I just add a lot that are coming through the Haitian Humanitarian Parolee Program are very well educated doctors, lawyers, speaking English. So we're also seeing a lot of highly educated Haitian clients arriving.
What happens to refugees after 2 years?
Yeah, so that's a good question. So we are able to support clients from date arrival to up to 5 years, but I think right now, and Anka, you can correct me if I'm wrong, we don't know what the process will be for these Haitian clients after 2 years. They will have to apply for asylum, and that will be their pathway to citizenship.
That's correct. That is correct. Does IINE work in partnership with any NGOs in Haiti or partners with other US nonprofits working with Haitians, especially in New York or Florida?
Yeah, so we work within Massachusetts. So we are not working with any agencies in Haiti, but we are working with other nonprofits within Massachusetts that support Haitian clients, such as IFC, which we mentioned earlier. And
I just want to jump in, like there are other states in the country that are really being impacted by just a huge wave of people arriving and are trying to establish the systems and the supports that they need. So we're learning all the time from other states, particularly in New York and New York City, that has, I think, seen 40,000 people this year. Also really interested. We do a lot of domestic resettlement work, but always interested in sort of connecting to that international component. So if there's anyone on the call who wants to connect with us, we're always trying to sort of bridge that gap to understand when people show up, it's really it's a point in their journey that starts and overseas, and there are many people and providers supporting from the very beginning overseas. So just wanted to throw out there, we're super interested in partnerships, so please be in touch.
Another question is about the highly educated Haitians, like doctors. Are they put to work in the US where such skills are needed?
So that's a great question. I think to become a doctor in the US, it's a very long pathway. And we have had a number of clients. For example, we had a client from Iraq who came, he was a doctor in Iraq, and it took him 10 years to become a doctor. He worked in Whole Foods part-time while he was going through medical school and then residency. And I think just this last year became a doctor. So eventually, yes, but I think it is still a long pathway to reach that job that you're qualified for when you are coming to the US. So we are working on providing employment support, but that initial job that a lot of our clients receive probably will not meet all of their qualifications and credentials.
Yes, unfortunately, credentials from other countries do not qualify in the US to the same level. So if you are a doctor or maybe an engineer, or I think there are many high skill positions that you will have to re-credential in US in order for you, or go back to school, or get an apprenticeship job, or work into a lower position just to be able to get closer to whatever you used to be in your profession back home.
And I think we've seen that with a lot of the Afghans that arrived last year. A lot of our Afghans are now in school for those professions that they worked in Afghanistan, with the hope to get back to that job here in the US.
Right. Can Haitian apply for asylum? Is there a deadline for applying for asylum once you enter the US?
So yes, they can apply for asylum. I do not know if there is a deadline for applying for asylum, but I think the biggest challenge is finding a lawyer to support with that asylum application. And then the cost.
I think there's the 12-month
Right.
cap, so you need to apply within your first 12 months, and if you can't do that, you're cut off from that option.
Right. What specifically can Haitian Americans do to support?
Yeah, so I think Haitian Americans can support the work that we do. We have volunteer opportunities at our agencies. We have job openings for Haitian Creole speakers. We have our refugee youth mentoring program where a Haitian American could support mentoring a Haitian youth. As I mentioned, we have a lot of 20 to 25-year-old Haitian arrivals. We also have ESOL classes that utilize volunteers and are a great way to volunteer. I know many of our Haitian staff are also applying for their family to come over. I know there have been some delays with that processing, but yeah, I don't know, Anka, if you have anything else to add.
No, I think you covered everything. So the racism Zen mentioned earlier, can you share more about that?
I can kick it off. You guys can add to it. That's a strong word, but I chose to use it because I think the Institute has been very impacted, particularly since the Trump administration, about what was always very challenging US immigration policy becoming much more challenging for certain populations. And those populations seem to be largely from countries where most people are people of color. And we've seen really different US policy treatment. We've seen different contracts, federal contracts that come out for support for certain populations. We've seen just a real disparity in the way people are invited into this country, how long they're allowed to stay, how much support they're given. And it creates a a real challenge for an organization like ours that is trying to meet people where they are, create equitable treatment and services so that everyone gets to some basic milestones of support. Most of the people that we're serving are incredibly poor, and they need to just stabilize before they can start to really integrate and become, I think, what this country was built on, which is really the work and the support and the influence of immigrant communities. So we are very disappointed that we're struggling so much to find resources for certain populations, and for others, there's an incredible amount of resource. So that is also why we fundraise, so that we can equalize some of our services and make sure everyone gets the support they need.
And I just to mention, just want to say that I was talking to the employment team the other day, and they mentioned how all our Haitian clients, all they want to do is work. The moment they come in, they step foot in our office, they ask to work. So I think the way they put it, they are very easygoing clients, and they don't require much. They just want to work. I just wanted to mention that. What trauma care is available to Haitians?
Yeah, so in Lowell, we partner with the Lowell Community Health Center Meta Clinic, which specifically supports our refugee and Haitian clients trained in trauma care, and they provide behavioral health services. So we refer all of the clients that we serve to the Meta, and Boston also works with local health centers to refer for behavioral services.
How long does it take to get a work permit? How do you understand the difficulty in Haitian refugees getting work permits? I'm familiar with a number of Ukrainian immigrants who arrived since the war started, who were able to get work permits fairly quickly. What's the difference?
Yeah, so right now, Haitian humanitarian parolee clients who enter through this Biden program are able to get their EAD card very quickly. The process was streamlined with Afghan and then Ukrainian arrivals, and that is staying kind of the same timeline for Haitian humanitarian parolees getting their EADs within 2 to 3 months. The biggest challenge is with the Cuban Haitian entrants, so those that are coming across the border, not with the humanitarian parolee. That timeline has remained long and can take up to a year or sometimes longer to get their EAD card.
Thank you, Caroline. I don't think I have any other questions.
I thank Anka and Caroline and Rodney and Schaid and Zan's whole team who helped to coordinate today's webinar. We're grateful to all those who tuned in. This has been recorded. And as Anka and Zan mentioned, we're in the middle of this work. 10 families came here today, and our staff right now is out in the front of our area here, entertaining kids, working a little bit late tonight, waiting for them to get placed in hotels. And so we're in the middle of this work. And I'm grateful to Anka, Caroline, everybody on the team for the work they're doing. And we're grateful to you for your support. And we see this as a moment of crisis. People are in need of support, but we're also seeing this as a moment of great hope and opportunity. These folks have come here. They want to work. This is a state in a region that needs people to work. The first thing they want to do and the most eager thing they want to do is get to work. And so let's look upon this as an opportunity. We appreciate any support you can give, any contributions you can make. If you have questions, reach out to us. The recording will be on the website soon. Thank you so much for tuning in and for supporting the International Institute of New England at this important moment. Take care.